Though. Hello, everyone. I am live, and today we are going to talk about medical startups, but also specifically credentialing. So, as I say to many different people, I'm streaming from many different platforms on Facebook, YouTube, and also LinkedIn. And then I also have the Wisdom app as well. So, hello, everybody. I'm Courtney Herring. I'm the owner of Atlanta Telehealth. I do several things, and one of my best or my niche is healthcare. And I just love healthcare a lot. A lot of you probably know my story. And if you don't, I will do another segment just totally about my story. So basically, let's get started. Right now, we are in a time where there's a lot of healthcare providers and or just people, just even like me, who want to actually have a medical practice or something that is helping others. So it could be behavioral health, going into therapy for themselves, and seeing their own clients, which is totally awesome, right? That's great. And, with all of the things that are happening, especially with behavioral health, it's very important, right? That we have this. So let's get started. So if you would like to create a medical clinic, and this is what I mean by this, or healthcare clinic, all right, any type of, this goes for everybody, a hospital, small hospital, right? A clinic, literally a medical clinic, dental people, therapists, behavioral health, any type of office that's going to take insurance, I would like you all to listen up because this is very important. So, one thing that all of you guys know is I talk about insurance a lot because one thing that's near and dear to my heart, especially with one of my agencies, is, medical billing. So with medical billing, right, there is really no medical billing if you are not able to take insurance. So of course, yes, you can bill and all of that good stuff. Yes, it could be private pay or self-pay, but let's get real. Everybody is not using and just handing out thousands and thousands of dollars to see you. I'm sorry, I don't know who everybody thinks they are, but let's just be honest. Normally, the ones or the people that do get straight up cash would be your cosmetic surgery, obviously your Botox, and then some dermatology, things that are actually happening. If it is not a medical necessity, more than likely, as you already know, insurance is not going to cover that. Okay. So with that, when we're actually creating private practices, we always advise that people understand what is and how do you actually get credentialed? How do you get insurance, right? How are you taking Blue Cross and Blue Shield? How are you taking Medicaid and Medicare? And I want to state this again. If you are actually taking insurance, I advise you to take all of them. And I will tell you why as we continue to go on, and I'll make a little note to make sure that I go over all of this. All right. So let's get started. So someone wants a medical practice. Again, I don't care what it is. I don't care if it's behavioral health or just straight up medical. The point of the matter is that you want to be available for the masses, of course. So let's pick on two insurance companies that everybody loves. So the first one we will pick, which is Medicare. So Medicare has different jurisdictions in the United States. So where I am right now in Atlanta, Georgia, our Medicare or our jurisdiction is Palmetto GBA. In Florida, I believe it's First Coastal. Everybody has their own thing. There's Noridian. There's all types of different stuff, right? So Medicare is also not just Medicare. So let's say I am in one state and I want to go to a different region, which could be, Florida. Guess what? I have to let Medicare know that I'm also seeing people in separate regions. All right. It's not across the United States. That's number one. Number two, with Medicare, you can apply in a couple different ways. One way is by paper, and some people actually like to do it by paper. And they say that it takes long. Listen, both places take long. Nobody is quick with credentialing, period. It's all about what and how do you feel, right? So right now, Medicare has changed their application since, I definitely know since last year. They've added some more things to some of their applications, like Suboxone or controlled substances at the end. So just pay attention. So don't use an application that somebody had in 1979. It has changed and it will deny. Okay. As you're going through these applications, they're going to ask you a lot of different questions. There's a couple things that everybody needs to know. One, obviously your date of birth. We need to make sure that you have a NPI, which is basically how I describe it, a social security number, right, for you as a person, the healthcare provider. Then, yes, of course, are you a solo provider? Is this a group? You have to let them know how are you going to structure, right, your medical practice. And then again, who owns it as well? Who is owning this practice? So with all of that, you have to share your social security number. They're going to ask you where and what state were you born in. They're going to ask you all types of different questions. Why? Because first, this is the federal government. And then, number two, they just want to make sure that you're going to use government funds in an appropriate way. Okay. Now, here is the key. And I can't go into every single insurance, right? But Medicare, especially, if you can work with me here, then it'll apply to many. So with Medicare, you're going to fill out different forms. One is an 855B. That one is going to be for like your clinics, right? Or your small practices. You can also fill out an 855A. That will be for your facilities or your laboratories or even DMEs, right? Now, not all the time do they fit in very little segments like that, but that is honestly the truth, okay? That's the generalization. Most of the applications in paper applications are about, 45 to 50 pages long. It doesn't mean that you have to fill out everything, but every piece of paper or every time you look, it'll say check, is this relevant or is this not relevant? So you have to make sure that everything's filled out. Also, let's make sure that if you're a prescribing physician, that you have your DEA license. Your DEA license has to be updated. We cannot have anything that is expired. Also, let's make sure, especially if you're a nurse practitioner, it depends on what state you're in. If you also have to have your RN license to also get your APRN license, which is your advanced, nursing license. So there's so many different things that you have to have. And what I tell people is if you've worked at any other place, I don't care if it's a hospital, I don't care if it's a group practice, you guys need to know some things, okay, for credentialing to go smoothly if you want to own your own practice. You need to know where all your licenses are. You need to know where your higher education degrees are. You need to know where your DEA licenses are. Where did you take your life-saving skills like CPR? All of those things that make you whole. Even on some applications, they're going to ask you, where did you do residency? And also always make sure that you have at least 3 to 5 references that you can always put on any type of application or form. And we'll kind of go through that as well as I continue to do these lives, but I'm specifically talking about credentialing. And again, credentialing, the definition that I believe is it is the act of sending your information, meaning healthcare provider, into a insurance company, whether it's government or commercial, that is they're wondering and they're trying to figure out and make sure, right, that you are actually who you say you are. Are you a board certified physician? Do you have the license? Do you have everything that you need? Now, one thing with Medicare, and I know that the licensed counselors are still fighting with this. Right now, LPCs cannot get Medicare. So that is not going to happen right now. I know that a lot of you are lobbying for that to be able to take Medicare, but at this time, that is not available. So let's continue to move on with Medicare. All of your signatures, they need to be legible. Sometimes you can get away with signatures being electronic signature. They were okay with doing that, definitely during COVID-19, because everyone was not in the same place. So when we did a lot of the credentialing forms, we were able to send them electronically and get them to sign off, right? The next thing is you just have to also just pay attention. The forms seem like they would be very easy, but sometimes they're not. You can actually get hung up on like little silly questions. Let me see if, sometimes they'll ask for the tax ID number, right? Or they'll ask for your social security number. Well, it depends, right? If you're a solopreneur, right, and you are going to file your taxes just like a normal person, you and I, right, then you'd use your social security number, right? But if you're a solopreneur and you have a private practice, then you're going to go ahead and identify and use your tax ID number. So there's a lot of different things that can go wrong in credentialing. The other thing that I love to explain to everybody about credentialing is that it takes time. It takes a very long time. None of this is easy. None of this is quick. It is not, okay? It is hurry up and wait. But what will save you time is hiring the correct people to be able to do this. So I do know that a lot of providers say, oh, I'm going to do it myself and all of this stuff. Well, let me tell you what it really takes to do that. Now, some of you have gotten lucky, which is wonderful, but let's say that you own a group practice and you have 5 providers. Let's just go through just Medicare alone, okay? That means that let's say we're just doing paper now. So the application is 50 pages, and then you're also going to do that 5 times for 5 people and gather up all of their information and get a W-9 and all of their licenses and all of that stuff. I highly doubt that you're going to have time for that. That's a lot. There's a lot of other things that you could be doing, like writing your policies and procedures and getting yourself ready and together, and even just finding a space, right, for you to actually work out of. Some people ask us and say, hey, I want to take insurance, but I have not found a space yet. Here is one trick that you can do. This is not for facilities. This is not for anyone else. This is for your solo or your small, kind of like a group practice. You can use like your home address, and then once you actually get the lease or whatever it's built or whatnot, then you go ahead and you change the address, because that's actually where you're going to be doing the procedures, right? So again, there's a way to get around that. At this time, it has been taking a good 180 days, and that's for a lot of them. It depends on what state you're in, of how fast they're going. My business office manager, director will tell you that Texas went pretty quickly for us. We have people all across the country, and they were quick with Medicare, Medicaid, and even their commercial. But one of the ones that is really, really slow is actually North Carolina. They're just slow, period, just pushing out applications for any of their insurances. And one of those reasons is because North Carolina has just changed. Since July, they now just don't have state Medicaid. They have the Medicaids where it's AmeriHealth and AmeriGroup, and then the WellCares and all of that, and the Ambetters. And some states have already done this already. So let's go back, to our lovely Medicare. So you send in the application, right? We're still talking about paper applications. Do not just send it with a stamp, okay? Because they're going to tell you that they didn't have it, and they don't have it. Like, this happens all the time. It happens all the time, all day long. Sometimes we'll even send things and they only got pages 1 through 20. How that happens, I have no idea. But it does happen. And so then we'll have to resubmit, right? But if you are just sending this through the mail and with no type of tracking number, that's going to be a mess. And I'll tell you why. A lot of times they do things in batches and they pick up things in batches. And think about it. There's all these different papers and everything, I'm sure. And things get mixed up and things also, get lost. So if you have no way to call them to the table and say, hey, I did actually send this out, you're done again. You're going to have to resubmit it again. So let's make sure that if you're sending anything paper, that you actually have a tracking number. What our protocol is and why we have such a successful rate for credentialing is because our staff calls every week. Why? And yes, it does take almost 180 days, right, for these to get, processed and for you to even be able to see somebody or even get a welcome letter. Yeah, it does take that long. That's not a joke. But here's the other problem. You have to hold them accountable to what they said or what they have emailed you. So for instance, I already know they've sent us something saying that we missed something. We didn't have, some type of document. So what we did was we had to fax it over. But every time you fax something over or every time you speak to somebody, you need to get a reference number, the name of the person, and the time. So what we do is we have all of that documented, because when something goes wrong, again, you cannot hold anyone accountable but yourself because you're not organized, right? So things happen in credentialing where you would not even believe. Okay. One time, I even did something and it was Medicare, and they lost my application like 3 times, and it's true story. I still have the receipts. Nobody knows where it is, but guess what? They don't care. So you have to resubmit. So as I said, with Medicare alone, theirs can be extremely, extremely long. And when we're getting into facilities and all that good stuff, it's even longer and even more information that you need. Surveys. I mean, we're not even going to go there, right? So let's go to Medicare. Also has something called PICOS, and that is where you can actually apply online for Medicare reimbursement. And I say that because, yes, it is a lot nicer. It is, not automated, but you're able to, get in there and type everything up and all of that good stuff. But you also have to be able to upload things. And as we all know, in any type of system, in any world, sometimes that doesn't work. So then that means we're mailing things again, right, for signature or whatever, what have you. But the biggest thing and the biggest reason why I wanted to talk about this today is because if you are not paying at least $300 a panel or more, you're not going to get the service that you need. It takes a lot of manpower. So what have I done? I figured out how long has it taken us to do a application, from sending the application to doing any corrections or things that people have lost, right? And then all the way to like a welcome letter, right? For you to be able to even take the insurance. And I can tell you right now, it's over 30 hours just for us. and calling. And that's not even filling out the application. That's after the app is gone. Because as you all know, if anyone has called any type of state government office, it's not like they're like, oh, hello, hi, Courtney, you called. No, you're sitting there on hold all day long. But we have to do that, right? Because this is important to you. And you can't open if you don't have this. So it's very important. So I will tell you that you're going to get what you pay for, especially for credentialing. If anyone tells you that they can credential you in 30 days, that is not true. Like, let's just cut it out. That's not true. There's no way. And I can tell you that right now. I've done this for many years, and our system is spectacular. And I mean, I have receipts. That's not true. And then the other thing that is not true is you have to remember, like I said, if you have 5 providers, that means that it's 5 applications. So let's say that we're also doing, right, 5 insurances. So Blue Cross and Blue Shield, Aetna, Medicare, Medicaid, Cigna. So that's 5. So let's do 5 times 5, right? 5 times 5 is 25. So we're doing 25 applications. That is a lot of work. So I'm talking about 30 hours just for one of them to see them all the way through to your thing. So that is why credentialing costs a lot of money. And I will tell you that right now. A lot of times people have went and paid people who are saying, oh, it's 125 for this one and that one. I'm going to tell you now that it doesn't matter which application you're doing. One is not harder than the other. So yeah, one might be longer than the other, but I'm telling you the same thing and it's the follow-up. It's not necessarily all the paperwork. And also, a credentialing agency should be asking you for all of these items that are needed. So if you do not have a CAQH, and I'll go ahead and put all of these acronyms, in the chat and stuff so that everybody knows what these are. But the CAQH is something that keeps all of your information. So that will be where your licenses will be, your references, and all different types of things will be in that database. And that's something that you really want to be able to use. And as I was saying before, if you work for another place or you as the provider, you need to know all of your username and passwords, because I don't know what that's about, but that is like a problem. So let me just give this information to you. So if somebody was crazy, right? And so now they have access to your DEA number, they have access to your license, they have access to your NPI number. You don't even know how to get into the CAQH or anything to check and make sure everything's good. Why don't I just call up Walgreens right now and go and do my own medication? I'm just saying that. I know you guys can't see me on Wisdom, but I just took a sip of my coffee. Everybody, it's your license. It's your stuff that's on the line and all over the place. I don't care if it's I know it's a lot of work, but at least you should be able to have all of your username and logins and know where everything is at. Because when you want to open up your own private practice, you don't want to be calling your old job with somebody who might not even work there to try to find your password. That is all of your stuff. That's all of your information. So I do want to make sure that providers understand that's on you. And again, like I said, you know how it goes. There's a lot of fraud out here. And so now some random person, and you can't even look and see what they're doing, has your DEA license, NPI, and all of your license numbers. So I'm just going to call up Walgreens and get every prescription that I need, because I can just be you. So I just want everybody to think about that and really drive that home. So also make sure that whatever agency you're using is reputable. Like, do they have references? Who else uses them? Are they on the internet? How do you find these people? I'm in Atlanta, Georgia, so if something went wrong, you would be able to find me. I have over 38,000, followers on LinkedIn. One of my business partners is Shanae Murray. She has over 1 million on LinkedIn. We cannot ghost you, right? So stop picking people that you don't even know where they are, right? Or they're not showing up on Zoom or whatever. Stop looking at that. And also, credentialing takes a team. If someone is telling you that they're doing it all by themselves, I'm telling you right now, it's going to be slow. It's going to be all over the place. I'm not saying that you can't have somebody start out, right? And it might be their first time being a solopreneur. I started out by myself, but I didn't take 10 people either, because I knew how much I could do on my own. So again, just think about it. One private practice and there's 5 people, that's 25 applications that I have to watch every day. Every week. That's a lot. Okay. So if you want credentialing done, either do it yourself or you need to pay for it. I'm telling you now. And also watch out for people that could literally take everything that you own, because you're handing over all this information. And it's not like Walgreens. Because I know, I've seen that, people have done that. They'll take your stuff and they'll call up Walgreens and they'll show up as a patient and get their prescriptions. But then what will the medical board say? The medical board will say, well, how did they get that information? It'll be your fault. So let's not have that happen. So let's get back on track. So with credentialing, as I said, there's a lot of things that you have to have, a lot of paperwork that you need to have in order. And I would advise for you all to just keep like a binder. Keep a binder, because sometimes in some instances, I think it's a health port or health one port. There's so many different things that we have to use to credential across the nation. But they ask, when was the first time that you had liability insurance? So if you've been in the game for 20 years, you need to know when that first, liability insurance, like we were first active, if that makes sense. So there's a lot of things that you have to know. And or have your hands on, right? So if you want to just hand it over to a credentialing agency, that's totally fine. But just make sure that you have it so that we're not bugging you. Because a lot of times, the other reason why it takes so long is because we're literally waiting for people to even apply for their DEA license. Sometimes there's people that hire us and they don't even have their DEA license yet. And that can take a while. It's over $700, and it depends on, what you are, nurse practitioner or MD, and it takes a while. So then we're just sitting here waiting, right? Because you're unable to do that. So I do see something in the chat, and I'm going to see if anyone has any type of questions. So somebody obviously is spamming. So again, Arshad Ahmed, I wouldn't do that. That's not very nice. Get your own live. Yes. And Danielle Tribby, yes. If you're doing well and you're doing cash pay, that's great. But again, cash pay is for only certain people. So you're not going to service the masses, right? People from low income are not going to be able to pay you. But it also depends on what you're doing. So good for you. And I think that's great. So again, cash is fine, but it doesn't always work for everybody's demographic and their specialty, right? So that's not what I'm trying to say, that you can't do a cash patient or cash, but I'm just saying it might not work for every demographic. And also, everybody, let's not always do everything for the privileged. Let's also do everything for everyone. And that's what my medical practice does. I work with veterans only right now. I will expand, but I feel as though our nation's veterans are one of the very disadvantaged folks that have given their service, and a lot of people won't take them because of reimbursement. And that's sad. And doing God's work doesn't always mean that you're always getting $1 million a patient. So I'll leave that there. Yes, patience is a virtue. And someone said, Michael Anderson, we've been doing PICO's enrollment for 9 years, and it's quick and faster approval. And yeah, it can be, but Michael, some people don't even have a PICO's. So it depends. And I will leave that right there. But if anyone else has, any other questions, please go ahead and let me know. I will be on here for another just 15 minutes. And maybe you guys are asking, why are you doing this? I'm doing this because these are the most frequent questions that people ask us. I'm doing this because I'm also a part of Growth Academy, and what we are doing is also creating different places for people to go. So also for healthcare, people in healthcare, what do they actually need to be doing in order to be successful? It's very important. And I'm doing this to make sure that people really understand what does it take. And, even though we're doing all this telehealth and we're doing all of this and this, the point is to do the work that you said you would do, which is, all in every ethics, a code of ethics, whether you're a therapist, LPC, counselor, MD, or nurse practitioner, in every code of ethics, it always says something in there of do no harm. Right. So if you're here just for the money, it's not going to work, because people are going to be able to see that, and it's going to be a shame, because I hear about you guys all the time that don't really care about their patients. I have someone here saying that they've worked with plenty of startups and they'd hire somebody, to do the credentialing, and they found out they did nothing, and that stinks. Yes. And it delays all their business and income and workflow. And you don't want that, right? Get it? But that's why you pay. You have to pay, right? You have to pay to play. If you are, a pediatrician or whatever, you got to pay for it. If you are, you just got to pay. You get what you pay for, right? Period. And the other thing is you have to remember that credentialing is also very, very important, because that's how you're billing. So if your credentialing is a mess and you think that, I have Blue Cross and Blue Shield, and then all the Blue Cross people come in, and then you send out your first claim and it denies and says that your NPI might not be linked to the group tax ID number, this is a huge problem. Right? It's a huge problem. It's going to set you back. And a lot of times that'll either bankrupt people, or people just will close their practice down. And it's a shame, because those are very easy fixes, or things that, definitely shouldn't have happened. And that's usually, the issue at hand, right? It's people being lazy, or people that, just might not have the not even the expertise. But like I said, if somebody is charging $125 a panel, it's not going to be enough. They're not going to do it right. If they do, they must be your friend. And I'm going to tell you right now, they're not calling on your panel every week. They can't. And the reason why they can't is because there's not enough time, and you don't have a team. And you have to have a team in order to do this. There's no way that you can just do this alone. This is complicated. Things go to different places. I'm not even going into your electronic health record yet. I'm not even going into, if you've worked somewhere, what happens. I'm doing the very basic, and I'm starting with Medicare, because everyone says that's the hardest one, and I think all of them are difficult. All of them have some type of irritating thing that they all do. So don't just say, it's Medicare, or it's Medicaid, or it's the VA. They're all slow. All of them are slow. But I also want to say this. We have to remember that it was COVID for everybody. And COVID just didn't hurt, just people that and patient population or whatever. it also hurt people that were working for these insurance companies. Some people died, right? Some people, I mean, they were sick too. So you have to understand that they might be behind, but they also might have lost a coworker or lost a supervisor or lost somebody that worked there. So we also have to remember and we have to think about what are we really doing and who are we as a people when we're building our practices and we're doing all of this stuff. It just takes time. COVID did not just happen to you, it happened to the world. So as we're all seeing supply chain issues and all of this stuff and all this other crazy stuff, that is what happens when certain things, occur. So I'm going to continue to go through and I don't know. Yes, the best way to hire an agency is to ask questions prior to giving them the credentialing process. But what I will interject, though, is that a lot of people don't even know what happens in the credentialing process. A lot of times people are coming from, large practices that they didn't own. So they have no idea. They have no idea. And that's okay, right? But what your credentialing agency should be able to do is tell you exactly what step you're in and where you are in the process. There should be no, I don't know where my application is. There should be no, I'm whatever. And one thing that we do, we actually have something where when we call, they can see, okay, Courtney Herring, and then they also see the number and they see the sequence. Like if you have to press 1 or 2 to get there, be transparent, because if you're the credentialing agency that really sent that out, then they should be able to call themselves and also see their own application going through the works, right? They should. So also as credentialing agencies, you have to be transparent and they have to be able to get the information, that they need as well, whenever they want to. And that's one thing that we do. We're always transparent with everything. People can call us really anytime. But also we have a certain software that we use where they're able to see absolutely everything that we've sent and all of that good stuff. But yes, people are saying some really great things, especially, I think it's on LinkedIn, which is super cool. So I totally, appreciate that. So again, with credentialing, it really is how you start your practice, right? And you have to know certain things. You have to know who can take what. And I'll tell you this as well. Sometimes people will say, oh, I'm just going to bill under so-and-so's NPI. You don't do that. Why would you do that? I don't understand. Okay, so let's say that we have a licensed clinical social worker, right? But then we have a BA or an MSW and they're not licensed and they're billing underneath us, but they're billing for hours. That's completely different. But once they're licensed and they're ready to go, they should be billing for themselves as well, meaning getting credentialed on their own. The other thing that I will say, because if you think about it, if you're signing off on that note, and I know I always go back to billing, but if you're signing on off that note and I'm the person that's licensed and the other person is like the intern, you do understand that your license is on the line. I hope everybody understands that. So why would you want to continue to do that? So once they're done, they get their license, then you go ahead and pay for them to get credentialed. Don't just allow people to bill underneath your number. That is ludicrous. Because if something happens, guess what? They're coming to you and not to that person. What are you going to say? Oh, well, they did something wrong. Well, you had to sign on the note. So then obviously, you're in trouble for that. So let's not do that. The other thing that I definitely know that happens a lot. So people will come to us and they'll say, yes, I was a provider for 20 years and I've taken Blue Cross and I've taken United Healthcare. And we're like, you know what? That's dope. That's fine. But let me make sure that everybody understands. Number one, I don't care if you have billed Blue Cross and Blue Shield before. I don't care where you billed them. If you, the provider, do not have a contract with Blue Cross and Blue Shield that says your name on it, you're not credentialed with them. They know you as a provider that might have billed under a practice, but you're not credentialed. So that means that you have to go through the whole credentialing process. So stop assuming, right, that you have this. Because 90% of the time that people come to us, they're like, oh, all you have to do is do an ad change. So let's also make sure. Ad change, meaning like some people will say, oh, well, I'm credentialed and all you'll have to do is add this person and then add that. It is not like that at all. There is no ad change. There is no quick fix. There is no nothing. You have to go through the whole credentialing process over again. So if you contact our office and you say that you're credentialed, I'm going to ask you for your welcome paper. I'm going to ask you for all of that information. And the reason is because it's a waste of our time to do certain things and then you're not credentialed, right? Like, stop. The other thing that I will tell you all is if you are a provider, and even if you're in, a group practice, that's super awesome, like good for you. But if you also want to be, I think, more employable, have your own, get your own credentialing out of the way. You, the entity, the healthcare provider, you can have Blue Cross and Blue Shield on your own. You can do that. Start doing that. Start investing in that. You know why? Because when I interview people and they say, oh, I have to update my CAQH and I don't have this and that, I know that it could be 7-8 months until they're going to be able to work. I'm not willing to do that as an owner. So go out there and get credentialed. People can credential whether a solopreneur or not, right? Get those credentials. And then last thing, I used to live in North Carolina. I lived there for like 10 years. And there's something called, Cardinal Innovations or Alliance Health. And that was, the Medicares of that region or whatnot. And what I will say here is this. I moved there in like 2010. And still, when I left there in 2017, they were still closed. So that means if there's an insurance that's open, go and apply for it now. Because I'm going to tell you right now, it's not always going to be open. Now, I haven't checked, so you can quote me, but not quote me. But I can say in Florida right now, what's closed is United Healthcare, Aetna, Cigna, and there's another one. They're all closed. They're closed because they have too many providers and it's saturated. Now, they might have just opened. Now, this was 2 months ago. So you do have to call a lot and see if they're open or closed and all that stuff. And open means that they're actually taking providers. And also when they're open, you have to make sure that they're taking your type of provider. That doesn't mean that they're taking you as an LCSW or a nurse practitioner. You have to make sure, right, that they're taking you. They don't have to. Right? The other thing is you have to, I just say, if you see that there is an insurance company and it's open, go ahead and get that done now, because when it's closed, it's closed. And sometimes they're closed for years. And that is what happened in North Carolina. And some, social workers and other practices, they were unable to do anything because it was closed. Right? So you couldn't even open really anything. And that's where people started spilling into different, states and stuff like that, because they couldn't even use insurance in that place. So I'm going to end here, and I'm just want to say things in closing and give you just 5 things to think of. Number 1, credentialing cannot be $125 a panel. That is ludicrous, and there's no way. So don't call us for that one. Number 2, make sure that you have all of your usernames and passwords, whatever type of thing like a CAQH or a PICOS or whatever or wherever you put your licenses and stuff, know your username and password and know who's touching your stuff, right? Then number 3, do your research, get references, talk to people. Also, if they don't have an online presence, that is a little concerning. It is now 2021. We're about to be in 2022. And I'll just be honest, if by COVID you are not online with your credentialing services, and I'm talking all over, then you have a problem, right? You don't really care about visibility. And then number 4, you have to have patience. Just remember, I'm talking about you have to be patient. And then number 5, you've got to know all the facets of actually opening up a medical startup. There's so many different things and so many things that could actually go wrong. And are we actually going to create some digital products to help healthcare providers? Absolutely. That's definitely coming in 2022. But again, stay strong, do whatever you need to do, continue to be healthcare providers, but always remember that your licenses are very important. And if you allow other people to get a handle on those or get those, and you're not paying attention, that is going to be a shame on you. So again, I will be back on Monday at 12 noon. I always, love questions. If anybody ever wants to go ahead and, just message me or whatnot, you can text me at 678-761-5956. You can also, I can never remember our office number, of course. Or you can email us at admin, ADIM, at atlantath.com. And you will also see me as well with Shanae Murray with Growth Academy. And that's where some of our digital products are going to be. So again, thank you all for coming. As you know, I just kind of started this kind of thing and I think I'm liking it. So again, everyone have a great weekend. If you have any questions, hit me up in the DMs and we'll talk soon. All right, bye.